Hello everyone, I'm Dr. Sophie Caldwell, and I've been working in men's health for over 30 years now. Today, I want to have an honest conversation with you about something that affects millions of men, but rarely gets discussed openly. I'd like to start with a simple but incredibly important question. How many of you have noticed changes in your body that weren't there before? Perhaps things you used to do so easily no longer work quite the same way. You might find certain movements or activities more challenging, or you've noticed new physical changes that seem unfamiliar or unexpected to you. As we age, our bodies change. Sometimes these changes remind us of our youth, and sometimes they surprise us. The male penis is one of many areas that undergoes changes with age. These changes are perfectly normal, and there's absolutely nothing to be ashamed of. They're part of the beautiful and inevitable journey through life. As we get older, our bodies evolve and our sexuality follows suit. The topic of aging and sexuality is often surrounded by silence and even shame. Changes in the male sexual organ that occur after 60 affect millions of men, yet they're rarely discussed. I approach this subject with respect, warmth, and professionalism. I know this might cause some anxiety or concern, but I assure you there's no reason to worry. Understanding that these changes are part of the natural aging process is essential. This discussion is for people who've reached this stage in their lives and who may have doubts or concerns about their experience. This conversation is for those going through this new chapter and who are seeking clarity, ideas, or simply a discussion of the topic. You're at a unique stage in your life, and I encourage you to follow along with me throughout this discussion. I promise to give you valuable information that will help you approach the changes you're experiencing with confidence and ease. Let's dive into this topic together with an open mind and a desire to support one another on this aging journey. From birth until the end of life, the human body undergoes constant changes. The male body is no exception. What changes can be observed after 60? Are these changes normal? How can we manage them? And most importantly, how can we maintain a fulfilling intimate life despite these changes? Let's take a closer look. The first change you'll notice in the male member is its elasticity. The tissues in this area of the body lose flexibility over time. This change affects the entire body. Natural aging leads to a loss of muscle tone and skin elasticity, and the penis becomes thinner and less elastic. Research shows that collagen production decreases by approximately 15 to 20% per decade after age 30. These changes have a direct impact on rigidity during sexual activity. Most men are able to obtain and maintain erections more easily before 60. However, with age, this response may become less consistent or slower. This is the result of a biological phenomenon that we need to understand. Blood circulation becomes less efficient with age. The blood that fills the corpora cavernosa of the penis during arousal becomes less powerful. Atherosclerosis is a phenomenon where the walls of blood vessels become rigid. When blood vessels stiffen, blood flow to the penis can be reduced, making it more difficult to maintain and achieve an erection. Studies indicate that up to 52% of men between 60 and 70 experience some degree of erectile dysfunction. This is a normal part of aging, but there are ways to manage this issue. Some men notice they're less able to become aroused or that their erections are softer. Understanding these changes helps reduce feelings of embarrassment or anxiety. Erectile dysfunction is a common problem amongst men over 60. If you're over 60 and experiencing some form of erectile dysfunction, don't worry. There are many ways to address this problem, both physically and psychologically. Many men manage to maintain a satisfying intimate life despite erectile dysfunction. Men suffering from erectile dysfunction have many options, from medications to lifestyle changes, relaxation techniques, and therapy. Remember, this isn't something to be ashamed of. In my 3 decades of practice, I've seen countless men regain their confidence and quality of life with the right support. Low testosterone levels are another important factor in sexual health. Testosterone, the male hormone, is responsible for many vital functions, including sexual desire, mood, and energy. Testosterone production begins to decline after 40. By the time men reach 60, this rate decreases even more significantly. Research shows testosterone levels drop by approximately 1 to 2% annually after age 30. By 60, you might have 30 to 40% less testosterone than you did at your peak. Declining testosterone levels can lead to decreased sexual desire and libido in men. This is normal and nothing to worry about. Men often notice their libido has decreased and they're less inclined towards intimate relationships. If the desire for sexual activity decreases, it doesn't mean pleasure or satisfaction have disappeared. This is actually a wonderful opportunity to rediscover sexuality in a more emotional way. Men can explore new forms of intimacy with lower testosterone levels. The focus shouldn't be exclusively on rigidity or orgasm, but also on emotional and physical connection with your partner. It's possible to have a rich and satisfying intimacy without needing the same physical intensity as in previous years. It's about developing emotional connections and strengthening the sense of closeness. Many men over 60 experience a decrease in penile sensitivity. In addition to changes in testosterone levels, men may find it harder to reach orgasm, or it may take longer to get there. Men may report that their pleasure is different or even less intense. This is partly related to the decreased blood flow and elasticity we've already discussed. It's also related to a reduction in the number of nerve endings in the penis. Such a decrease in sensitivity can initially be a source of concern. However, with practice and patience, many men can continue to derive satisfaction from sexual experiences. Remember that adult sexuality differs from that of younger people. This is a new stage of exploration. At this stage of life, it's possible to redefine intimacy and pleasure in new ways. Some men have discovered they can experience more satisfying intimate encounters when they place less emphasis on their physical performance and pay more attention to emotional connection. It's also important to consider the role of the mind in sexual health. As men age, their sexual experience may change due to emotional shifts. Men experiencing physical changes, erectile dysfunction, or declining performance may feel anxiety, frustration, or shame. It's crucial to understand that sexuality depends not only on physical performance. Emotional closeness, communication, and understanding are vital for maintaining fulfilling relationships. Some men perceive these changes as a loss of masculinity or strength. This is a misconception about a natural process. Just as our bodies age, so does our perception of intimacy. It's important to accept aging and learn to welcome change with an open mind. Men can navigate this stage with confidence if they understand that these changes are part of a new life stage full of wisdom and possibilities. A man's sex life after 60 doesn't mean he's lost his vitality. Rather, it's a transition to a new stage of life that opens up many opportunities. Men can enjoy deeper intimacy with their partners by demonstrating knowledge, patience, and clear communication. Many men say that as they age, they feel a greater emotional connection and greater satisfaction with their partners. This can lead to richer and more satisfying experiences. It's important to understand that approaching this stage of life doesn't mean the end of an intimate and fulfilling existence. Men can experience meaningful sexual and romantic relationships by adopting a positive attitude, showing open-mindedness, and being willing to accept change. It's important to remember that whilst the physical aspect of sexuality may change over time, this evolution allows for a more profound experience. Sexuality in later life is often less focused on performance and more on trust, emotional connection, and mutual satisfaction. This allows for a richer experience, where pleasure comes not only from physical sensations, but also from intimacy and closeness with your partner. In old age, sexuality can bring new joys because people feel more confident, more open, and more conscious. They can appreciate intimacy more thanks to the wisdom they've acquired over the years. This is an opportunity to rediscover yourself and your partner. It fosters love, trust, and deeper satisfaction that strengthens closeness. This state of mind allows us to view aging as an opportunity to build richer and more fulfilling relationships, both physically and emotionally. Now, let me share some practical advice based on my years of experience. First, regular cardiovascular exercise improves blood flow throughout the body, including to the penis. Walking briskly for 30 minutes, 5 times a week, can make a significant difference. Second, maintaining a healthy weight reduces the risk of diabetes and cardiovascular disease, both of which contribute to erectile dysfunction. Third, consider your diet. Foods rich in flavonoids, such as berries, citrus fruits, and red wine in moderation, have been shown to reduce the risk of erectile dysfunction by up to 14%. Communication with your partner is absolutely essential. Many couples I've worked with have found that honest conversations about these changes actually strengthen their relationship. Don't be afraid to discuss your concerns, desires, and needs. Your partner wants to support you, but they can't read your mind. If you're experiencing significant difficulties, don't hesitate to speak with your GP. There are effective treatments available, from oral medications to other therapeutic options. In my experience, the men who do best are those who seek help early rather than suffering in silence. The NHS offers excellent support services, and there's no reason to struggle alone. Stress management is also crucial. Chronic stress elevates cortisol levels, which can suppress testosterone production. Whether it's through meditation, yoga, gardening, or simply spending time with loved ones, find ways to reduce stress in your daily life. Sleep is another factor that's often overlooked. Poor sleep quality is directly linked to lower testosterone levels. Aim for 7 to 9 hours of quality sleep each night. If you're experiencing sleep difficulties, address them. They're not just affecting your rest. Smoking is particularly harmful to sexual function. It damages blood vessels and restricts blood flow. If you smoke, stopping is one of the best things you can do for your sexual health. Similarly, excessive alcohol consumption can interfere with sexual function. Moderate drinking is fine, but heavy drinking takes its toll. To summarize, as men age, they see changes in their bodies. This includes changes in sexual health. After 60, many men experience alterations in their sexual health and function. These changes are part of the natural aging process and can depend on factors such as decreased elasticity, reduced circulation, and lower testosterone levels. Men may experience reduced libido and less sensitivity. This can lead to slower or less sustained erections. These changes may cause concern, but they don't mean the end of a fulfilling intimate life. It's important to understand that sexuality isn't simply a continuation of youth, but rather a new stage of exploration where communication and emotional connection with your partner form the foundation of intimacy. Men may experience psychological challenges such as frustration, anxiety, or feelings of inadequacy due to these physical changes. To overcome these difficulties, men need to accept themselves and show patience. They also need to explore intimacy in ways that focus less on performance and more on connection. It's best to think of aging as an opportunity for wisdom and growth, rather than a sign of declining masculinity. Men can have sexual experiences that are just as rewarding and profound as in their youth by adopting the right attitude and approach. To navigate this stage successfully, it's important to cultivate strong emotional bonds, practice open communication, and accept the changes that naturally come with age. I've been privileged to work with thousands of men throughout my career, and I can tell you with absolute certainty that this stage of life can be incredibly fulfilling. The men who embrace these changes with curiosity rather than fear, who communicate openly with their partners, and who take proactive steps to maintain their health, these are the men who continue to enjoy rich, satisfying, intimate lives well into their 70s, 80s, and beyond. If you've found this discussion helpful, I encourage you to subscribe to my channel. We'll continue exploring important topics related to health and well-being as we age. Take care of yourselves, and until we meet again, embrace this beautiful journey of aging with wisdom and joy. Remember, getting older is a privilege denied to many. Let's make the most of it.